Welcome and thanks for listening to the Quick Shift to Technology. Here I'll be talking about how we supported the behavioral health communities in a global pandemic. My name is Elise Kohl-Grant and I am the CIO of Innovative Management Solutions, NY. So here I'll talk about we had a specific focus on telehealth. But before I get into that, let's just talk about the 80-20 rule. Now, it doesn't matter what industry you work in, we are all familiar with the 80-20 rule for the most part. But in healthcare, this hits us the hardest. We have established so many initiatives to target this 20%, and yet year after year after year, it remains true that 20% of the population take up 80% of the healthcare costs. People cycle in and out of the healthcare system, so people change. But the numbers, well, the numbers remain the same. And who are these 20%? These are the 20% that I represent. These are the folks who suffer from substance use and mental health issues and are impacted by the social determinants of health. The healthcare system has continued to evolve. And we see that the people change, but the circumstances remain the same. I don't want another parent to have to walk in their room and see their child lifeless on the floor due to a drug overdose. Or have a cousin wonder where his loved one, his family member is at because his family member doesn't know if they're going to have a roof over the head the next day. These are the faces that I represent, and these are the faces that I fight for every day so that they can access the tools they need to get the services that they deserve, just so that perhaps maybe they can survive for one more day. And how do we do that in a global pandemic? Well, we had a focus on telehealth to make sure that we're still able to extend our hand and provide access to the services that these individuals you see on this picture here, the services that they needed. And we had to act quick, and we had to use telehealth as a resource, as a tool to reach people where they are and support the communities that need us most. We had to respond quick, so therefore we evaluated telehealth solutions. We negotiated telehealth discounts for more than 80 agencies. And from this day, we've distributed over 500 telehealth licenses, and that number continues to grow each day. We want to put tools in providers' hands so that they can reach vulnerable populations, the people at risk, the people that you saw in that photo. Now I want to make 2 points, however. Is 2 points that I've noticed through my journey in working in the healthcare system, specifically on the technology side, is 1, we always think we know what's best for our patients, our clients, and 2, there seems to be this bias towards the population we serve. That we don't think they're going to use the technologies that we have to offer, or that maybe they don't have access to the technologies that we want to use. Newsflash, the communication has changed. People are accessing the internet every day, and our people are going on the internet, our people are going on social media, and our people are using Facebook and using Instagram. They may not have access to the same tools we have access to because I don't think we've created and extended those tools for them to use. Leading back to the bias, and also leading back to we always think we know what's best. Do you ever, as a healthcare provider, include your patient in on a technology purchasing decision? How often do we ask them after we deploy technologies, how often do we ask them if they liked it, or if it helped them, or if they enjoyed using it, or if it was easy to use? Sometimes we do, but I'll tell you something, definitely not enough. So after we distributed these telehealth licenses, we asked our people what they thought. and if they like it or not. Wayne Smith said, you know, I'm alone, but I feel everybody else's energy mentally. Benjamin, he said it gives me comfort and it's a way for me to engage and see what's going on in society. Johnny Boy said it's nice to have a virtual family when you have to stay home. Our people use the technologies that we give them access to if it's easy to use and if it's available, especially during these times of crisis and these times of needs. The policy needs to catch up, however, because the innovation is not that behind, but the policy is. Now, we saw the policy switch during COVID, but we'll see what happens in the months to come. And I worry about folks like Johnny Boy who might not have a telehealth license, or their provider can't access or can't afford certain tools that Johnny Boy is used to using. Because now he's used to using a service, and I don't want to have to be that person that tells his provider that we now need to take it away. That just does not seem fair to me. So how is the policy going to catch up to the innovation and continue to allow us to reach people like Johnny Boy, like Wayne, like Benjamin, even after this pandemic is over? The fact that we were even able to do this so quickly and create a difference in these people's world means a lot to me. And I'm proud to be part of Innovative Management Solutions NY. We're a new venture of 2 New York Behavioral Health IPAs, and boy, is it something beautiful when 2 so-called competitors can keep their ego at the door and come together and partner together to leverage shared resources to promote a healthier New York. Because that's what I'm a part of, and that's what we did. One IPA, Coordinated Behavioral Care, located in New York City, that covers all 5 boroughs, and Coordinated Behavioral Health Services located in the Hudson Valley. Together, we support over 80 community-based organizations across New York State and cover about 160,000 Medicaid lives. We leverage community partnerships, and we definitely have an emphasis on social determinants of health, because this is what impacts our population every day. Our goal is ultimately to improve quality, cost effectiveness, and efficiency for the healthcare delivery system through providing tools like telehealth solutions. We're working on several other things, but that's not for this presentation. But it's partnerships like this that are needed more than ever, especially as we see this tremendous growth in Medicaid enrollments. Now look at these numbers year after year. As healthcare providers, we look at these numbers and we see people, we see faces. Tech startup companies, when they look at these numbers, they see opportunity. They see increased spending. They see inefficiencies. They see market potential, and they see market entrance. And hey, you can't knock them, because at the end of the day, that opportunity provides us options. And we like options, especially when it comes to technology. We like options. And we need to have options to create an opportunity to make a difference for the population that we serve. There's different ways to spark change and different ways to make a difference in this world. But it can get really complicated real fast. And I'm not just talking about telehealth now. I'm talking about all of the tech companies that we see entering the market. And if you have technology in your title, or information or innovation in your title, guarantee you're getting called and your phone's blowing up from these tech companies. And again, it's not a bad thing, but we have to figure out how to navigate the system. When you take a look deeper and you look on the left-hand side, these are the digital health venture capital funding trends from 2010 to 2019. And boy, have they grown. They're broken out into different categories, and you kind of see the different trends over the years, and it definitely makes sense as if you are a healthcare provider working in this field, it makes perfect sense, right? When you look on the left-hand side, look at telemedicine, look at analytics. I can't wait until 2020 comes, and boy, is that telemedicine bar going to be off the charts. So we've seen increased spending over the years. In New York alone, 79 New York City-based healthcare startups received $703 million in funding alone. Unfortunately, 8 out of 10 startups fail, so you as healthcare providers need to be smart about what technologies and what companies you're partnering with, right? With all these options, it's hard to pick out the best opportunity for you and your agency. It's hard to navigate this complicated system, and in order to navigate it, you need a method. So I can share my method that I used to evaluate the telehealth solutions. And I've used this method for other technology initiatives that we've pursued. You use this PASS method when you need a quick response and a quick evaluation. Nice and easy to understand. Does it pass your criteria? The PASS method is broken down into 4 categories for you to evaluate the same vendors. The 4 categories are price, accessibility, system functionality, and security. When you're looking at price, you want to ask yourself, can you afford it? Are there associated fees? What is the time commitment? What are the resource costs? And are there ongoing costs? In terms of accessibility, you want to look at, is it easy to use? What's the user interface? Does it fit within my already established workflows? How will my clients, my patients access it? Will it impact their data plans? Because remember, I work with Medicaid individuals. I represent Medicaid populations, and a lot of them are on data plans. So these are things that you have to think about when you're pursuing different technologies to implement. Going on to the 3rd category, system functionality. What are the available features? Is it customizable? Do they provide real-time reports? What's the difference between basic and upgrade? Last but not least, security. Is it compliant? What's the user access? Is it HIPAA compliant? Is there a hierarchy in terms of how it's built? What's a password retrieval? And so on and so forth. It's as simple or as complicated as you need it to be, but trust me, this method was so useful when I had 20 demos set up over the course of a week and a half. And you better believe I'm not going to remember every single vendor that I demoed. So I used this path methodology and took notes and organized them within these categories so that way I could compare and come to the conclusion and come to the right solution that was the best fit for not just me, for not just my clients, but also for the agencies and the providers that use them. So I invite you to borrow my method. But in order to get to the right questions, you need to ask yourself, what type of access do my clients have? So we went and we surveyed, and this was before COVID, but I want to share these surveyed results because they are a real eye-opener. We surveyed 429 Bronx Medicaid patients. And I'm talking about these folks were the real deal. These folks have been in and out of group homes, in and out of psychiatric hospitals, in and out of homeless shelters, suffering from substance use, on suicide watch. And they took this survey and we set up 7 focus groups, and we even surveyed 76 providers. And when I say providers, I mean case managers, social workers, rehabilitation counselors, those types of providers. And the results were really interesting. 71% of them have access to smartphones and they access the internet multiple times a day. 51% of them have used a health app, and 63% of them said that they will use a health app. Now, of course, we got to do something with that 29% on top, right? How do we reach the 29%? But 71% of Medicaid patients in New York have smartphones, and we're not leveraging this tool effectively to reach these individuals so that we can put the care in their hands. When you want to dig a little deeper and look at some of the other questions we asked and some of the other features that they requested, these right here in front of you are fairly simple features. 86% of them said that they wanted appointment reminders. 73% of them said that they wanted some way to manage their medication. 73% asked for text messages. 72% asked for urgent alerts. 72% asked for a way to schedule appointments within their mobile device, and 67% thought it might be nice to have some way to access educational information in a meaningful manner. And surprise, surprise, we asked the providers, and it pretty much mirrors what the patients themselves said. Now, when you're looking at this, and when you're looking at the features that are requested, we gotta be doing something wrong here, folks. We must be skipping over some real basic points and trying to build some real complicated data stuff and invest in some real complicated technologies when simple features like this are missing. Now, if you're a medical provider that works in a hospital, you're probably saying, or that works, in primary care, you're probably saying, well, my patients have access to this. Another news flash. Your patients, our population, you probably see them once a year, maybe once every 2 years on a good day. We see them all the time. And I'm telling you that the tools we have available, the tools that the providers use, 99% of them do not have these basic features. And that's a problem. And it's a problem that we're not utilizing and investing and trying to create an uptick in these features to reach the populations that need us the most. Because they're telling us that they'll use them. We have this bias that the Medicaid population does not communicate like you and I communicate. And that's just not true. It's not true. Our people just don't have access to these tools. And that's why they're not being utilized. Let me tell you a quick story. I haven't been to the dentist in 2 years, okay? I told this to my dad and he freaked out and he's like, Elise, you're stressing me out. And I was like, no, I just got to go over my presentation with you. So this is a story, but it's a true story. I haven't been in the dentist in 2 years. And I have a chipped tooth and a missing filling. So half of my tooth is exposed. And I bet you that I will not go to the dentist until I'm hurling over in pain. What does that say about me? I'm a well-educated woman with an MBA that works in healthcare, and yet I still do not know how to prioritize my own health. So if I don't know how to prioritize my own health, because I get busy with whatever the heck I'm doing, how do we expect someone who is a mother of children that doesn't know if they're going to have enough food on the table the next day to feed her children? How do we expect her to prioritize her health? How do we expect the gentleman who is sleeping on the streets and not sure if he's going to have a roof over his head the next day? How do we expect him to prioritize his health if it is not impacting him or hurting him at that particular exact moment? Would a text message help? I'm not saying it's going to save the world, but I am saying that it's a way to get care into their hands. It's a way to send care to them instead of expecting them to come to us. Because if it's taken me 2 years, I can imagine how many years it's taking someone else who deals with so many more barriers than I can even ever start to imagine. I truly believe with simple features, like a simple text message, a simple telehealth call from your case manager can ultimately change the course of someone's life. And that leads me to talk about the continuum of injustice that I've seen over the years. The health disparities that we've witnessed that are still here time and time again. And it would be inhumane of me not to bring this up, especially during these times. Not to bring up how the health disparities are correlated with the race of individuals, the age of individuals, the income of individuals. And the evidence is just striking. So take a look here, and we've geomapped New York City. Now, we originally geomapped New York City to identify where our programs and our services were located, and so that we knew where to deploy certain services and certain telehealth services. But here you see, we started tracking when COVID hit, we started tracking on the left-hand side by zip code, the population per zip code that have tested positive for COVID. The darker the shade, the more individuals per population per zip code that have tested positive for COVID. The next graph that you see, same boroughs, same city, same zip codes. These are the confirmed deaths due to COVID. Started tracking those. The darker the shade, the more deaths per population due to COVID. You move on, age of individuals, the darker the shade, the more population, the more elderly population exists within that zip code. You move on, for race of individuals, the darker the shade, that means there is an increase in population that identify as non-white, are minorities. Last geomap you see on your right is the darker the shade, the more individuals that are publicly insured. Now, when you compare these zip codes, it is so alarming, I can't even begin to explain my feelings around it. And especially in the times that we live today. When we were trying to figure out certain funding mechanisms and which zip codes to hit, which ones were already the hotspots, but which ones we needed to predict would be the hotspots, it shames me and it brings tears to my eyes, but we looked at the zip codes that were hit the hardest, and then we looked at the next zip code that had the highest percentage of individuals that identified as non-white. The zip codes that had the highest amount of minorities. Of course, the zip codes that had more elderly population. But there is a significant correlation between this, and it's something that we need to look at. It's something we need to talk about. And if you're not talking about it and you work in healthcare, you are not helping the solution, and you are not part of the solution, and you are part of the problem. I invite you to click on this link below, and you can access the maps. We've done a number of things. We update it almost on a daily basis based on the COVID data that we retrieved from New York State. And take a look at this. It's really striking. And that leads me to end my presentation with a quote from Governor Cuomo. And he said, initially he asked front workers to continue to go to work despite the risks. And when I say front workers, I don't just mean providers and nurse practitioners. I'm talking about the case managers. I'm talking about the social workers. I'm talking about the administrative staff that are checking people in and out of homeless shelters and in and out of food pantries. I'm talking about the rehabilitation counselors, not the folks that are necessarily licensed. I'm also talking about the peer specialists. Those are the frontline workers that I clap for every day at 7 p.m. in New York. And he said, our frontline workers are modern day heroes. And in that moment that he asked them to continue to go to work and serve our country, they were not Black frontline workers. They were not white frontline workers. They were not Latino frontline workers. They were not Bronx frontline workers or Brooklyn frontline workers or Buffalo frontline workers. They were just Americans. They were New Yorkers. They were linked by the commonality of humanity. And if you want to make a difference, you've got to look at the data. You've got to figure out what our populations don't have access to that everyone else does. And you've got to be New York tough. You've got to be smart. We've got to be united. We have to be disciplined. And overall, we have to be loving. And with that, my name's Elise Kohl-Grant, CIO of Innovative Management Solutions, NY. I'm happy to take any questions that you have. Thank you.